Welcome to today's Practice Advantage Pearl. Today I'd like to talk about getting off the bench. Practice Advantage had done a Sentinel Practice Advantage benchmarking survey in 2007 for pain medicine groups. That survey has been replicated and validated just a year ago now. And what I'd like to do is talk a little bit about the benchmarking data and why that maybe hasn't changed so much in the past year. Initially, the benchmarking data covered the parameters of operations, financial management, some of the nuances of site of service, and those kinds of things. And what we found was, because Medicare really hasn't changed much in the past 7 years, nor have some of the private payers and some of the reimbursement climate, other than some bundling, some changes in RVUs, but the minor changes that have occurred have really left the benchmarking well validated from that time. So let's take a look at some of the key indicators, some of the findings that we had at that time that were revalidated. One of those is the number of staff that support each pain physician across all sites of service remained at right around 5. A little bit less, 4.8, but nonetheless, the same number of people are supporting a pain physician in practices across all sites of service. The number of unique patients per year, the number of patients served on a unique basis, still around 2,000, 2008. The number of encounters for those patients has been around 3,500 to 4,000. That stayed the same. The percentage of new patients into the practice, 20%. Again, almost identical to previously. And here's one that really I thought was eye-opening for me, is the collections per physician across the sites of service remained at about $650,000 to $700,000 on an annual basis. So irrespective of site of service or geography, that stayed the same. So what did it take to generate that type of collections? Clinic hours per week, about 23. Number of procedure hours per week for interventional pain, average 16. So that remained almost constant as well. And then finally, for me, it was the accounts receivable. How well are they working their dollars in their billing and collection cycle? And actually, the outsourced is doing the same as it was previously, outperforming in-house billing by about 2 or 3%. Now, that may not sound like a lot, but on an annualized basis, that can be thousands of dollars. So I want to encourage you to take a look at what benchmarking opportunities you have internally, and if there are societies that you work with, either professional societies like the AUA, or perhaps it's the American Neurological Society, take a look at the benchmarking that they do for practice management, participate. Participate in medical group management, MGMA surveys, so we can increase and improve that pool of knowledge to help us manage our practices better. Thank you for joining us for today's Practice Advantage Pearl.